Hi, my name is Julie Lamb, and this is my personal philosophy of nursing. I made this Venn diagram to better describe what I think are the three most important realms that are going to be part of my nursing practice. Direct patient care, operating on a micro and meso level, and looking at nursing culture through a macro level approach, describing nursing as a profession. One of the most important things about this diagram is that it puts patients at the center of the idea of what I'm doing, and that's crucial. Patients are just the most important part of being a nurse, but there are other things that can improve patient outcomes by looking at patients at different levels. So I'm going to describe that throughout the paper. Before I delve into this idea, I want to let you know that I am going to be referring to the American Nurses Association Code of Ethics and the American Nurses Association Scopes and Standards throughout the course of this video. And I'm going to abbreviate American Nurses Association as ANA, so you'll hear me say that throughout. For example, the idea of a patient-centered approach to nursing and putting patients at the core of everything we do is consistent with the ANA Code of Ethics number 1, the first provision of the Code of Ethics. So the idea that of direct care, I am committed as a nurse to providing direct care that is compassionate. And to me, the idea of providing compassionate care is providing care that's holistic, taking a look at the whole picture of my patient's health, what their environment they live in, their culture, their relationships, because all of these things have a role in patients' health, and it's important for me to look at as part of being a compassionate care provider. Another way that I'm going to provide compassionate care is being a patient provider. And by that I mean looking at this idea that Imogen King first described in her goal of attainment theory in 1981, is that healthcare achievement of healthcare is a cycle. Our patients, one of the toughest things they're going to face is behavior change. So as a nurse, I am going to be non-judgmental and be by their side as they go through the process of trying to achieve a health goal and failing and achieving again and failing. It's a process that we are going to continually work on, and that my idea is that as a nurse is that I will be standing by their side through that process. And this idea, the next idea of providing compassionate care is one that upholds the dignity of all my patients. I firmly believe that healthcare should be delivered without regard to race, economic status, educational background, sexual identity, gender, immigration status. I am committed to providing compassionate care that upholds the dignity of all my patients and care that is delivered equitably. And this is consistent with the ANA scope and standard number 7, as well as the Code of Ethics provision number 1. So the second realm that is important to my approach to nursing is looking at a meso or micro level. And what I mean by that is taking a broader view of our patient populations. It's part of our responsibility as nurses, as well as future clinical nurse leaders, to go beyond the realm of direct care. One of the first ways I'm going to do this is being part of a healthcare team. I am committed to being part of a team that is civil, respectful, and uses each other as some of our best resources. That has been shown to deliver positive patient outcomes. Most recently, as recent WHO studies have shown, using a multidisciplinary approach and a team approach to healthcare improves outcomes, and it also improves nursing satisfaction. Another important way that I'm going to look at a broader picture and be able to positively impact my patient's health is using an evidence-based approach. This means that I will use the most up-to-date clinical information for um, assessing my patients, diagnosing my patients, and offering treatments for my patients. And you might think that that goes in direct care, but we learned in 501 that using an evidence-based culture, so being part of a hospital system unit, um, doctor's office that uses and practices an evidence-based culture as part of the healthcare that they deliver will improve patient outcomes across a variety of settings. So that's another way that I'll look at a more broader view of providing patient care. And the third aspect of looking at this micro or meso level is taking a population-based approach. This is going to be crucial for me to help identify health disparities that my patients are experiencing and try to reduce them. I believe that health disparities are as important as looking at the physiological basis of disease. And incumbent in all of this is advocating for our patients, being the eyes, ears, and voices for our patients on a state, local, and national level so we can advocate for healthcare change when we see disparities arise. And this is very consistent with the Provision 8 of the Code of Ethics. The third circle that was in the Venn diagram that describes my personal philosophy and personal approach to nursing is looking at the macro level, the culture of nursing, and the idea that nursing is a profession. Nursing is not a trade, nursing is not a job, nursing is a profession. And the first way that we can describe nursing as a profession is that it has a standardized educational body of education, so that a nurse's education is standardized across the United States, and this lends itself to the idea that this is a profession. But secondly, nurses have a scope of practice. That means I can assess, I can plan, I can diagnose my patients within a scope that I am educated and certified to do. This means that I can practice autonomously or with autonomy, and with autonomy comes accountability. So we are also accountable for what we do. But that's those two ideas are twin ideas within the profession of nursing. And the final, most important aspect of the profession of nursing is the fact that it's self-governing. We govern ourselves and regulate. We have a regulatory body that operates state by state, that regulates the laws and bylaws under which we can practice. And that's crucial to the idea that nursing is a standalone profession. So, in summary, I cannot wait to join the ranks of the nursing profession. I am committed to providing care that is dignified and compassionate and equitable. I am committed to looking at the whole population, taking a population-based approach to treating my patients. And I also personally believe it's very important that nurses are work within their own profession, and that's something that's a core value that I hold about nurses. And that is my personal philosophy of nursing.